On average, almost 115,000 people in the United States are currently on the waiting list for a life-saving organ transplant. Another name is added to the national transplant waiting list every 10 minutes, and on average, 20 people die every day from the lack of available organs for transplant. Although the future of bioprinting is potentially threatening, every hospital needs a 3D printer as they can bioprint organs, create custom prosthetics, help surgeons, and, in the long run, is more cost-efficient. Even though the concept of bioprinting is fairly new, its theory runs deep in medical history. Bioprinting is the use of 3D printing technology with materials that incorporate viable living cells to produce tissue for reconstructive surgery. The history of bioprinting all started in 1989 when scientists formed cell theory and realized that cells are the building blocks of life. In the 1930s, the first computing devices were created, and in 1978, stem cells were discovered. Finally, in 1984, the first 3D printer was created by Charles Hull, allowing objects to be created from digital data. In 1996, the discovery was made that individual cell aggregates can be arranged and they could fuse, self-organizing and self-assembling, to form new combined structures. So far, there were no man-made organs implanted in the human body. At last, in 1998, biologist James Thomson developed the first human stem cell lines. In 1999, scientists implanted the first lab-grown organ. In the year 2000, medical fields began using 3D printing. Everything scientists have worked for over the past few decades came into light when, in 2003, Thomas Bolin created the first bioprinter. In 2006, computer mapping of the human genome from both physical and functional standpoints was completed. Again, in 2006, a lab-grown human bladder was implanted, and in 2009, the first blood vessels were 3D printed. Recently, a 3D printed hip joint was created by Materialis NV, located in Leuven, Belgium, to benefit a 15-year-old girl in Sweden with a congenital hip defect. The company, Organovo, has succeeded in bioprinting liver tissue that lasted 40 days in a dish. Normally, the tissue stops functioning in 2 days. Today, additional advancements in 3D printing enable production of bones, ears, exoskeletons, windpipes, blood vessels, vascular networks, tissues, and even simple organs. Scientists are now able to print custom prosthetics and surgical tools, and surgeons even use 3D printing to help see whatever they are operating on more accurately. Although the idea of bioprinting is fairly new and potentially dangerous, hospitals would majorly benefit from having one as they can be used to 3D print organs. Said organs would reduce the number of people on waiting lists for transplants. 3D printed organs would save so many lives as, on average, 20 people die every day waiting for an organ transplant. Scientists also have the ability to print many organs for use in drug testing on the human body. The Body on a Chip project will use 3D printing, or bioprinting, technology to create mini human organ systems about the size of a quarter to test the body's response to drugs. This would allow us to know what the effect of certain drugs on the human body are without harming anything. 3D printing also has the potential to eliminate animal testing altogether in the near future. So far, only handmade tissues have been implanted in the body, but scientists can only hope that somewhere in the near future we will be able to print implantable organs. Along with bioprinting organs, 3D printing also allows us to create custom-fit prosthetics. These prosthetics would majorly benefit people as they would be perfect for them. The prosthetic would be their exact size, allowing for easier movement. A man by the name of Richard Van Az made this possible. He created a product called the RoboHand, which allows users to move their prosthetic fingers, thus giving them the freedom to do more. This prosthetic has 4 fingers that open and close and grasps objects based on wrist movement. When the wrist folds, cables attaching the fingers to the base or frame curl the artificial fingers. This product is also more affordable as commercial prosthetics cost $10,000 or more per finger. The RoboHand only uses around $150 in parts. After posting about the RoboHand online, Van Az and his partner got an email from a kid named Liam who had lost several fingers from amniotic bend syndrome. His family was unable to afford traditional prosthetics as he would just outgrow them in a few months. Van Az created a custom RoboHand for Liam using 3D printing, and now other children in his area have heard about the hand and want one. Someday in the future, they will hopefully be able to print off prosthetics that are fully functional. 3D printed medical models can help surgeons plan out complicated surgeries ahead of time, as well as be an educational tool for medical students. This would create patient-specific organ replicas that surgeons can use to practice on before performing complex operations. This technique has been proven to speed up procedures and minimize trauma for patients. It would be majorly beneficial for a surgeon to see the tumor and be able to hold a model of it before they operate. In Dubai, where hospitals have a mandate to use 3D printing liberally, doctors successfully operated on a patient who had suffered a cerebral aneurysm in 4 veins, using a 3D printed model of her arteries to map out how to safely navigate the blood vessels. These models are also beneficial in the teaching of medical students in the way that they can practice made-up operations before they actually start operating on living things. It could also be a form of assessment to see if they're ready to graduate. Hospitals can use 3D printing to print off sterile surgical instruments, such as forceps, hemostats, scalpel handles, and clamps. Not only would the printer produce sterile surgical tools, it would allow the tools to be made smaller and more precise. The tools would allow surgeons to be able to operate in very small areas without causing extra unnecessary damage to the patient. One of the main benefits of using 3D printing, rather than traditional manufacturing methods to produce surgical instruments, is the production costs are significantly lower. 3D printed surgical instruments would be way more cost efficient and sterile than buying them. In addition, using 3D printing to print organs is more cost efficient in the way that it doesn't cost a life to save a life. The initial cost of the printer may be a lot, but the pros outweigh the cons, making its price worth it in the long run. As has been said, every hospital needs a 3D printer as they can be used to bioprint organs, create custom prosthetics, help surgeons, and, in the long run, is more cost efficient. Because of the printer, more lives would be saved. Less people would die from lack of organs, more people would be able to afford prosthetics, and surgeons would be more prepared. As stated before, every hospital needs a 3D printer.